Hello and welcome to Workers' Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome back to Season 2, Episode 2 of Workers' Comp Unwrapped. With me is Aisha.
Hi, everyone.
Who has 15 years of experience in the workers' comp industry. Today we're tackling, a question I know a lot of you are dealing with. Where do doctors usually struggle the most with their follow-up strategies, and how does that affect payment delays?
It's a great question, and honestly, a huge pain point for so many medical providers. We're talking about managing accounts receivable, or AR, in the wild world of California workers' comp.
Okay, so let's unpack this. For those who are maybe newer to the world of medical billing, can you explain what accounts receivable even means?
Simply put, it's the money owed to your practice for services you've already provided. Those outstanding invoices from insurers. In workers' comp, this can include everything from office visits and treatments to diagnostic tests. It's money you've earned but haven't received yet.
So it's like waiting on a paycheck, but for like a ton of different services, all with their own paperwork trails. No wonder it's a headache. Why is this such a problem in workers' comp specifically? Is it just the sheer volume of claims?
Volume definitely plays a role, but the bigger issue is the complexity of the California workers' compensation system. Think complex approval procedures, unique state regulations, and a high frequency of denials or underpayments.
Yikes.
It creates this perfect storm for AR nightmares.
That sounds incredibly frustrating for providers.
Yeah.
It's one thing to treat patients, it's a whole other thing to jump through hoops just to get paid for it.
It is. And what's alarming is that many providers don't realize the true cost of mismanaging AR. We're not just talking about like minor inconveniences here. This can have a significant impact on a practice's financial health.
Can you give me an example? Like, what's the worst case scenario here?
Imagine this. You've provided excellent care to a patient and the bill is $10,000. You submit the claim in crickets. Weeks turn into months, and you're still waiting on payment. This is delayed payment in action, and it's a major cash flow killer, especially for smaller practices.
That's terrifying. And I imagine this happens more often than people realize. What kind of delay are we talking about typically?
Industry data consistently shows that if you're not actively managing your AR and following up on those claims, resolution times can stretch out by weeks, if not months.
Essentially, you're providing an interest-free loan to the insurance companies.
Yeah.
There's got to be other consequences, though, beyond just waiting longer for the money, right?
Absolutely. One of the biggest risks is revenue leakage. Claims that aren't diligently followed up on have a much higher chance of becoming bad debt.
Meaning you never actually get paid for the work you did. Ouch. Just how much money are we talking about here?
It's estimated that providers lose a shocking 5 to 10% of their total revenue each year due to bad debt from neglected claims. Think about that. If your annual revenue is $1 million, you could be losing up to $100,000.
Wow. No practice can afford to just ignore that kind of potential loss.
Yeah.
So we've got delayed payments and potential revenue loss. What else contributes to these AR headaches?
We can't forget about the administrative burden. A disorganized follow-up system creates this mountain of paperwork, endless phone calls, and constant confusion.
Yeah.
It sucks the time and energy right out of your staff.
So instead of focusing on patient care or other important tasks, your team is stuck playing detective, trying to track down payments and decipher insurance jargon.
Exactly. It's a recipe for burnout, inefficiency, and ultimately lower quality care for your patients.
So far, we've established that mismanaged AR can lead to delayed payments, revenue loss, and a stressed out staff. But I'm curious, what are the most common mistakes providers are making when it comes to their follow-up strategies? Where are they tripping up?
Let's dive into that next. There are some surprisingly simple oversights that can have a huge impact on your AR success. One of the biggest pitfalls is a lack of standardized processes.
So it's like everyone's playing by their own rules and there's no consistency in how claims are followed up on.
Precisely. Imagine a football team with no playbook.
Yeah.
Chaos, right? It's the same with AR. Without clear written guidelines outlining when and how to contact payers, things inevitably slip through the cracks.
Okay, I see how that could lead to delays. If staff aren't on the same page, critical follow-up dates might get missed altogether. What else are providers doing that's kind of sabotaging their efforts to get paid?
Clinging to outdated technology, or worse, relying solely on manual tracking, is another major culprit. Think spreadsheets, sticky notes, a filing system that only makes sense to one person. It's a recipe for disaster.
It's like trying to perform surgery with rusty tools.
Yeah.
You might get the job done, but it's going to be messy, inefficient, and probably more painful than it needs to be.
Exactly. And the lack of integration between billing systems and claims management tools only compounds the problem. If your data is siloed in different places, it's almost impossible to get a clear picture of your AR situation and prioritize effectively.
So what's the antidote to this tech chaos? Are we talking about fancy, expensive software that only huge practices can afford?
Not necessarily. There are affordable, user-friendly solutions available that can automate much of the follow-up process. Think automatic reminders, claims status updates, even tools that can help you analyze your AR and identify trends.
Sounds like a huge time saver. But even with the best technology in the world, I imagine there are still human factors at play.
Yeah.
What about the people handling these claims?
You're absolutely right. Understaffed billing teams are a huge problem, especially for smaller practices. When staff are juggling multiple roles and constantly putting out fires, follow-ups inevitably get pushed to the back burner.
And I bet that's only compounded by the complexities of the California workers' comp system. It's not like billing for a simple office visit,
Right.
is it?
Definitely not. Navigating utilization reviews, filing lien for unpaid claims, dealing with disputes that might require legal action, it all adds this layer of complexity that requires specialized knowledge and skills.
So it's not just about having enough bodies. It's about having the right people with the right training.
Exactly. You need staff who understand the nuances of workers' comp regulations, who can confidently challenge denials, and who are skilled at communicating with insurance adjusters.
Okay, so we've talked about the importance of standardized processes, technology, and a well-equipped billing team. But what about the actual follow-up interactions themselves? Any tips for making those more effective?
Absolutely. One simple but often overlooked strategy is documentation.
Oh, I can see where you're going with this. In healthcare, if it's not documented, it didn't happen.
Right, you got it. Maintaining a detailed log of every interaction with payers is crucial. This includes dates, times, names of representatives, key discussion points, and any agreed-upon next steps.
So you're creating a clear paper trail that everyone on your team can refer to. That way, even if someone is out sick or on vacation, others can pick up where they left off without missing a beat.
Exactly. It eliminates confusion, prevents duplicated effort, and provides valuable evidence if you ever need to dispute a claim. And speaking of disputes, it's crucial to understand the appeals process in California workers' comp.
Oh, right, the dreaded appeals process. What's the biggest mistake providers make here?
Missing deadlines. Many denial appeals in California have strict time limits, and if you miss that window, you lose your right to dispute the claim. It's like missing the statute of limitations in a legal case.
Oh, that sounds terrifying. So time is of the essence when it comes to appeals. What can providers do to avoid missing those critical deadlines?
This is where technology can be a lifesaver. A good AR management system will track appeal deadlines and automatically generate reminders. It's like having an extra set of eyes watching over your claims, making sure nothing slips through the cracks.
Okay, so standardized processes, updated technology, well-trained billing team, meticulous documentation, and understanding those appeal deadlines. It's a lot to juggle. What about providers who are already feeling overwhelmed? Should they just throw in the towel and accept that AR is going to be this constant source of stress?
Absolutely not. Sometimes you need to call in reinforcement.
Reinforcements, like outsourcing some of the work.
Exactly. For practices that are truly drowning in AR, partnering with a third-party billing company or lien management service can be a game changer.
So it's like having a specialized team of AR ninjas come in and handle the heavy lifting.
That's a great way to put it. They have the expertise and resources to navigate the complexities of workers' comp billing and can often achieve much faster results than an in-house team.
This all sounds incredibly helpful. But how do providers know if their efforts are actually paying off? What are some key metrics they should be tracking to measure their AR success?
Let's talk about how to measure your progress and ensure you're moving in the right direction.
Okay, so we've covered strategies and even reinforcements, but how do we actually measure if all this is working? What numbers should providers be looking at?
One of the most important metrics is your days in AR, or DR for short.
Days in AR. What does that even mean?
It's basically the average time it takes to collect payment after you submit a claim. Think of it as a measure of how quickly your services are converted into actual revenue.
So the faster the money comes in, the lower the DRR, and the better for the practice.
You got it. A low DR usually means your billing process is efficient and payments are coming in quickly. Aim for somewhere between 30 and 40 days.
Okay, so that gives us a target. What else should providers be keeping an eye on?
Watch out for those aging claims, specifically the percentage of claims that are more than 90 days old.
Those are the ones that keep you up at night, right?
They can be. A high percentage of claims stuck in AR for that long is a red flag. It might signal problems with your follow-up process, issues with certain payers, or maybe a lack of prioritization.
So basically, don't let those aging claims pile up or they'll turn into a mountain of debt. What else can we track to make sure we're on top of things?
Keep tabs on your claim follow-up rate. This tells you how many follow-ups have been completed versus those still pending.
So we're making sure our team is staying on top of those claims and not letting anything fall through the cracks.
Exactly. And finally, don't forget to track your overall collection success rate. This shows what percentage of total claims are actually getting paid.
That feels like the ultimate measure of how well your whole AR system is working.
It really is. It gives you that big picture view of your AR health. You know what helps make all these metrics come alive? A real-world example.
Oh, a story.
Yeah.
I love a good story. You got one for us.
I do. Picture this, a California orthopedic practice drowning in a sea of unpaid claims, over $500,000 worth, and all older than 120 days. Their staff was overwhelmed, and their follow-up system was basically non-existent.
Wow, that's a lot of money stuck in limbo. I can only imagine the stress.
It was definitely taking a toll on their finances and even their ability to provide good patient care. But they took a deep breath and decided to overhaul their entire AR process.
Okay, so where did they even start with such a mess?
First, they used data analytics to pinpoint their highest value claims, the ones most likely to get paid. Then they implemented a structured follow-up system with automated reminders and those escalation tiers we talked about earlier.
So a combination of smart targeting and technology. Makes sense.
Right. And they took it a step further by assigning a dedicated billing specialist to be the point person for all insurance communication. No more confusion or duplicated effort.
So they streamlined their communication and made sure everyone was on the same page. What kind of results did they see after all these changes?
The results were pretty impressive. Within 6 months, they recovered $400,000 of that outstanding debt.
That's incredible. 80% recovery in half a year. That really shows what a difference a good AR system can make.
It really does. And it wasn't just about the money. Their average claim resolution time went down by 30%, meaning faster and more consistent payments.
So improved cash flow and less time chasing down payments. Any other positive side effects?
Definitely. Staff morale and efficiency got a huge boost. Having a clear and manageable process in place reduced stress and allowed everyone to focus on their core responsibilities.
It's amazing how much those seemingly small changes can impact the entire practice.
Absolutely. And the best part is these strategies can work for any practice, big or small. The principles of good AR management are universal.
So what's the key takeaway for our listeners today? What's the one piece of advice you would leave them with?
Don't let AR become this monster that controls your practice. With the right processes, the right tools, and the right mindset, you can conquer this challenge. You can reduce those delays, improve your collections, and most importantly, free up more time to focus on what really matters, your patients.
Beautifully said. Thank you so much for sharing your expertise with us today. This has been incredibly valuable.
It was my pleasure. I'm always happy to help providers thrive in the world of workers' comp.
And to our listeners, we hope this deep dive into AR management has armed you with the knowledge and tools you need to succeed. Remember, prioritize your follow-ups, embrace technology, and don't be afraid to ask for help when you need it. And if you have any success stories or brilliant follow-up strategies of your own, we'd love to hear them. You might even get featured in a future episode. Thanks for tuning in, and be sure to subscribe and share this podcast with your network. Until next time, stay proactive, stay informed, and keep those claims moving forward. Thank you for listening to Workers' Comp Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.